QR code there and get there that way. So lots of options, but a lot of the content we'll discuss is going to be there as well for you to see after the fact if you want to follow up. So we will go ahead and get rolling. We're going to talk a lot about sexual function and specifically erectile function tonight. This is a topic that, of course, is a little bit of a sensitive subject. Maybe you haven't ever spoken to anyone else about this, but let's be honest, it's something that matters to everybody. It's something that we all have, some knowledge of, and it's just part of life, and it's an important part of life, and it's a part of life that matters to men and to couples in a way that's far beyond what maybe our society or even we want to admit. It's way more than just being able to perform an act, right? It's about identity. It's about feeling complete. It's and all these things to men. And I only know that because I've heard it in my office when they've said this to me. And so, we're glad to be able to help really, truly with this. And we have a great team. Couldn't get through it without mentioning what a great team we have of guys that are all there to care for you. So let's just talk a little about what it is, and then we'll talk a little about what the options are and some of the causes and things like that. But erectile dysfunction is the inability to achieve or maintain an erection suitable for you, right? I mean, is it good enough for you or is it not? That's what we care about. If it's not, we want to work on that. How common is it? About 1 in 5 American men are going to have some component, probably more than that. If we're all really honest about, things as you get older. More than half of men over the age of 40. Okay, that's probably a little more accurate, and affects 39 million American men. So you're not the only one if this is something you're dealing with. And again, we're here to help. So the process, and this does matter a little bit for your little anatomy lesson, but there's basically a chamber on the left and on the right, and they of the penis, and they fill up with blood and create the rigidity. But essentially, these are kind of spongy like material in there that can just fill up and empty out of a fluid. And really, all that an erection is the filling of those chambers up with a fluid. It happens to be blood, until it's so full that it's pressurized and becomes rigid, right? And that's simply all that it is. And so what can cause it? Well, usually it's vascular disease, which is that the blood flow can't pump in there with enough pressure to generate the rigidity. It can come from diabetes, and that causes the trouble because it actually messes with the nerve signaling that signals the body to generate the blood flow that generates the erection. And then medications. A lot of the medications that men end up on as they go through life for other medical problems can actually be a cause. It certainly can be a cause. It can be caused from prostate cancer treatment, whether that's surgery or radiation of some form for prostate cancer. And it is a known precursor to diabetes, heart disease, and vascular disease. So actually, it's the canary in the coal mine, if you will. Sometimes this problem can show up and tell us that, in fact, there is a underlying problem in the heart or elsewhere that would be really good to know about. So sometimes this actually helps lead us to a deeper cause that may be life-saving. But we know that it has a huge negative impact on quality of life. As I mentioned, a really important part of life beyond just what we might think, and really to identity, to depression and how men feel and view themselves and look at life. So looking a little bit more about the connection to diabetes, more than 15 million men in the US have diabetes. That number, unfortunately, is growing every day. Men with diabetes are less responsive to the pills that we can give and will give to try to help with this problem up front. Again, that's because the problem with diabetes is really a problem of nerve signaling. The pills that we give, that you've all heard of, Viagra, Cialis, et cetera, are really to help with blood flow, right? But in diabetic men, blood flow might not necessarily be the problem. It's the signal that the blood, to get the blood flowing, that is the problem. And so in men with diabetes, the ED is more severe, and because they're often stacked with other issues, can be associated with decreased quality of life. So it can also emerge, as I said, because of nerve damage or neuropathy, damage to the small arteries, and then the ED meds don't help as much if the nerves are damaged. Again, usually diabetes is happening along with some of the other manifestations, generally happening to older men. The longer you've had diabetes and the worse it's able to been controlled by medication, additional vascular disease, medications that you may be on, or heart disease and some of the other hypertension and other disease states that can go along with diabetes that can factor in as well. So what about heart disease? Speaking of that, well, as I mentioned, if you have ED set in, it can be, not always, but can be a sign that you may develop heart disease within 2 to 3 years. Because again, the size of the vessels is what you want to think about here. The size of the blood vessels. Erectile dysfunction precedes coronary artery disease in almost 70% of cases, and that's shown here with the size of the blood vessels. So in the penis, the arteries are smaller here in the 1 to 2 millimeter range, and then in the heart they're in the 3 to 4 millimeter range and go up from there. And so if this vessel gets clogged up, it's only a matter of time till the next bigger vessel gets clogged up. And so that's why ED can actually be a warning sign of future heart disease as the disease progression continues. So we really pay close attention to this. We have a screening tool actually that we use for assessing men for the risk of cardiovascular disease. And we know, of course, that lifestyle intervention is an important part of that. Diet and exercise, weight loss, stopping smoking, and doing your best to reduce stress are going to be the way to prolong your life and improve the quality of your life with both regard to your day-to-day energy level and ability to function, as well as in sexual function. What about low testosterone? This is one that, surely if you've watched TV or listened to the radio or been on the internet, you've heard about low T. Well, we treat low testosterone, actually probably treat more of it than any other medical group in the area. But, there are a lot of these folks that are heavily marketing out to you, trying to convince every man that they have low testosterone. But what is really the connection? What does it do? Is it a real thing? It absolutely is a real thing. When your testosterone is lower than we'd like it to be, or than your body wants it to be, it's associated with obesity or weight gain, with diabetes, with blood pressure, high cholesterol, and asthma or COPD. And we know that 4 out of 10 men over the age of 45 will have low testosterone, and that will increase only continually as you get older. So we certainly pay attention to that and want to treat that. Now, the reasons to treat it are a little bit different, and we can talk a little bit about that. But the ways that we treat that are with a gel that you rub on your skin every day. We do a lot of folks that prefer injections. There are oral medications or even patches, which we don't use all that much. But there are very simple, straightforward, easy, and not expensive ways of treating low testosterone. And, it matters because really to your life and to many of the symptoms as far as how you feel and how you function. But it actually is, not able to really affect the rigidity and the blood flow for erectile function as much as it is energy level, sex drive, motivation, and those kinds of things. So to talk here for a second about prostate cancer treatment and how erectile function factors in there. When we remove the prostate surgically here, the prostate sits at the base of the bladder, kind of like a donut wrapped around the base of the bladder. And that then runs out to the urethra, the water pipe. And so when we go in and physically remove it, and you can see here with it out, we then put everything back together to reconnect the urinary tract. But these yellow things here are the nerves, okay, or neurovascular bundle. That's the nerves that send the signals out to the penis to generate the erection. And so those sometimes are cut. Even if they're not cut, they're stunned or temporarily non-functional. And so despite the surgical techniques getting better and better and really, very, very refined over the years, there's still going to be some temporary, if not some degree of permanent impact on erectile function. However, I would tell men, and please, if this is you or even somebody you end up in a conversation with 5 years from now, do not base your decision to proceed with prostate cancer treatment on what its impact is going to be on your sexual function. We have great, in this talk, we're going to cover all the great treatments that we have for erectile function problems. And we can absolutely get you going again, 100% guarantee that we can get you back in action one way or the other. And you should never shy away from doing the right thing from a cancer standpoint, because I promise I can help you out on the other stuff if and when it's needed. So sexual dysfunction after cancer treatment is going to hit everybody to some degree, and it can persist. I said temporarily, that's up to a year or even longer term after that. Whether you have radical prostatectomy affecting 25 to 75% of men, or radiation, the studies there would say closer to 50%. Again, there's a bunch of ranges there. So the reality is it's going to affect probably everybody to some degree, but we have great solutions for it. What about Peyronie's disease? What is that? Well, that's actually scar tissue that can form in that outer casing of the penis, which prevents that area from being able to stretch and generate an erection, and causes a curvature, causes a narrowing, or something of that nature. And so the ultimate outcome is that it leaves you unable to perform in a way that's satisfying to you and your partner, difficulty achieving or maintaining an erection, or the inability to engage in activity because of the curvature. So there are some treatment options for that. One is called Xiaflex, which is an injectable medication that we can inject in and try to break up the scar tissue to loosen it up, or surgical options as well that can get you back in action. So just to kind of get into now, talking more about the treatment options for erectile dysfunction, there are some alternative treatments that, again, are maybe popularized in marketing and media a little bit, but that we need to kind of be honest about the benefits of. And specifically, those are what are called shockwave therapy, extracorporeal shockwave therapy, another one called intracavernosal stem cell, basically injection, or another one called platelet-rich plasma injection. And these are all things that may have benefits in certain groups. They're under investigation, and they should be considered investigational. There are many places around town and around the country that charge a significant amount of money for these, and the benefits are very much still yet to be determined. And so we do warn against, or caution, I should say, going along with any of these, just because of the unknown benefit with a significant financial expense. So from a tried and true standpoint, what are the different categories and different treatment options? The first over here on your left is the oral medications. Of course, that's where everybody's going to want to start. Those are medications which can be taken either daily and kind of always in your system, or taken on demand or as needed when you think you might want to be active. And of course, everyone, every doctor, every patient's going to want to start there and hope that that will work. And oftentimes it can, to a degree, and we'll get into that a little bit more. And we'll talk through injections therapy, which is actually delivering medicine directly into that tissue that we talked about that engorges with blood. There's vacuum erection devices, which are out there, but kind of have, in my mind, use case, but there are some uses for it. Urethral suppositories have even less of a use. In fact, I don't know that I've ever written a prescription for that, though it seems like a nice idea. And then what are called penile implants, or a device that actually is placed inside the body, completely concealed inside the body, which actually can replicate the erection. And we'll talk through each of these things. So with the oral pills, how do they work? They increase blood flow to the penis, and they by opening up the body's mechanisms for blood flow and just really kind of encouraging more of it. And so they are effective generally in a lot of guys, at least to some degree, for some period of time, but it drops off pretty quickly, and it's not going to work for everybody over the years. Sometimes it's affected by whether you've had a meal where it can't be absorbed all the way. And it does have, some guys have side effects which are pretty bothersome. A lot don't, but some do, which would be headache, facial flushing, stuffy nose, upset stomach. And then you can't take these medications if you're on certain other medications, specifically usually ones for the heart. And so we have to be a little bit careful with that. So, it is logistically challenging to always have the pill available, be able to stop what you're doing and go take the medication, et cetera. So between it not working or logistically not working, there was a study that said almost half of men who try it eventually will give up on it. And then we did talk about diabetes, how these pills don't work quite as well. And ultimately men with diabetes have to move on to other treatment options. So moving on to what else is out there, intracavernosal injection is where we actually have you learn with our team helping to teach you how to inject medication into the corpus cavernosum, or into that tissue, that spongy-like tissue inside the penis. What that's going to do is deliver the medication directly where it needs to be, and then it will spread out and have its effect of really, really kind of driving that blood flow in a way that above and beyond what the pills can do. So this really can generally work. We can usually work with the dose and things like that to get it to a point where potentially it will work for most men. But a lot of men, at least this study was 40%, but I would say usually more, will ultimately discontinue the treatment. Mostly because of logistics, right? I mean, for some guys, it's great. Some guys absolutely love it, will stick with it for years. Other guys, they can't even consider it, because going, anywhere near their body with a needle just won't happen. And then some guys, it's just hard to remain in the mood, sort of for romance, if you will, while you're having to stop and do this. And then ultimately for some guys, it doesn't have the benefit. You have to carry it with you when you travel. It has to stay on ice and be refrigerated, et cetera. So there's some logistical issues, but we can usually get it to work. It can cause pain. And if you're for one of the unlucky guys that has that, then it may not be a good option for you. If the dose is too high, it causes a prolonged erection, and over years it can develop scar tissue from repeated injections. So as we said, the most common reasons for discontinuation are either that it doesn't work for you, it is uncomfortable, or you have that real discomfort and pain, or you just really don't like the idea or the logistics of having to do the injections every time. So, ultimately it does have a fairly high failure rate, but some men, it buys them some time, maybe months, maybe years. The vacuum erection device, this works by the laws of physics to create a vacuum in a cylinder that you place down over the penis, and you pull blood out of the body basically up into the penis by creating that vacuum. And then as you can see in the picture there, you actually have it shown in pink, a rubber band that has to go down around the base and trap the blood there. Once you pull it up into the penis, has to be trapped there. And so, it's something that, again, theoretically works sort of by the laws of physics, but practically speaking, is not really something that we, if I'm going to give you accurate expectations or realistic expectations, would say would be a great option for most men. Some love it. And a lot of men, we will use it for a purpose, which is actually for what's called penile rehabilitation after prostate cancer surgery. It's a way of kind of maintaining blood flow and stretching the tissues out. And so we certainly value it for that reason. But as a long-term solution, I quote a study that about 10% of maybe 11% of men, use it as their long-term solution. The urethral suppository, as I mentioned, I've never really actually used this in practice. It's a nice idea. It's actually a great idea in that you slide a little pellet of medication down the urethra, down the water pipe, and kind of plunger it in there like you're loading a musket, for lack of a better analogy. And the medicine should dissolve out into the penis from there. So, it doesn't really work that well. And oddly enough, it's very, very expensive, even though it's been around for a long time. I don't understand really why. but it's not real popular for a number of reasons. So one other thing to talk about here is what's called the penile implant. So this is a surgery where we put a device inside the body that recreates the natural erection. And I have to say, at first glance or first mention, this seems like one of the weirdest things that could ever have been invented by anyone. And how in the world does a device going inside the body recreate this or provide a good outcome? And I tell you, it's something I really believe in. And we've gone through a number of different options. And at the end of the day, this is one that if the other topics that were other options that we've talked through don't work or aren't desirable to you, this is something that really ought to be considered. So this is a surgery that I do quite a bit of, and we did over 100 last year, and I believe I've been told if you do more than 5, you're considered a high volume surgeon in the U.S. So we did, I believe, the most in the state, if not the broader region. And so in other words, I've been able to see a lot of men go through this and see the benefits that they get from it, and the ability to give them this part of life back in a way that works very well. And so I am a fan, and I tell people I never want to appear to be a salesman at all. But I do have to take the experience of the now hundreds of men that I have performed the surgery on and kind of package that up and deliver it back to men who are still kind of in that investigation phase or trying to figure out what's right for them. So, we really are always going to start with the pills, and then we are always going to consider the injections, whether you think that's something you want to pursue or don't think you could do. We'll have that kind of discussion in that branch point. But at the end of the day, I think it's worth talking through all the options, including the surgery, because as you're walking your way through this entire journey, you need to say, well, what are my other choices? What are all the options? And then you can decide for yourself as you're going kind of what's working for you and what else is out there. And then what else is out there that you might want to pursue. And so, as I mentioned, the erection is simply, well, let me see. The erection is simply the left and right chamber of the penis filling up with a fluid until it's so full of that fluid that it's rigid. And so if the natural mechanisms aren't working for them to fill up with blood and perform as you would like, can we recreate that in a way that's essentially exactly the same as far as the result? And so that's what this device tries to do. So we do a small incision and we put a cylinder in, an inflatable cylinder. It's just a glorified balloon on the left and on the right in those spaces that I showed you that have that thin, wispy kind of spongy like tissue in there. So they slide right in and just kind of part that tissue aside and slide right in. And then from there, it recreates the function quite nicely. Instead of filling those chambers up with blood, we're going to fill them up with water inside of these cylinders. But the end result is essentially indistinguishable from the natural erection. And we'll see a little video here. An animation of how this works. So this is an outpatient surgery. It takes about 45 minutes for us to do. You go home right afterward, and you have a very straightforward recovery. But the idea is that we put the cylinders in on the left and on the right of the penis, and then there's a control pump that's down in the scrotum, plenty of space for it to fit in there between the testicles, and you actually feel it through the skin and pump to transfer fluid, water in this case, right, into those cylinders, and then it creates the erection. Then there's a release button that you use to let it back down when you're done. And the fluid just transfers back and forth from this reservoir, which was tucked way back up inside there, out into the penis, recreating the rigidity and the erection. And it just goes back and forth like that for 10 to 15 years is the average lifespan of the device. So, as I said, we do it as an outpatient. We make a very small incision on the scrotum itself, put everything in from that one incision. You go home the same day. We have a good kind of protocol for symptom control, pain control, et cetera. a few days of taking it somewhat easy, not bedbound by any means, but also not out doing maybe all your full activities. And then you're back to normal within a few days, normal activities within a few days after that. Continued the healing process and the kind of getting used to things for about 4 to 6 weeks, and then you're able to begin using the device. And so it is covered by insurance. Certainly is covered by Medicare. We've not really had trouble with coverage, which is great, and we have a good team that works on that. So you would not have really any more out-of-pocket costs than you would for any other sort of minor outpatient surgery that you would have. And what are men experiencing? What are they saying? So on the left here, John had diabetes and blood pressure, probably contributing to his ED and need for it. And his comment was, the first time I've ever had surgery, and honestly, I was nervous. The recovery was very easy, and having the implant has been great. I got my life back. Cliff was a prostate cancer patient and said, what I've come to find out is that you are not alone in this. There's light at the end of the tunnel, and that may give you and your partner a new outlook on life and your relationship. And here's a couple of examples of men's comments that truthfully and honestly I hear dozens and dozens of times. I can't tell you just how much I've learned from men, my patients, along the way. And again, that it's much more than just about being able to perform a certain act, but that it's really so much about confidence and identity and feeling complete and whole. Here's two comments of the many dozens and hundreds that I've heard. It is a good operation. It does have 97% patient satisfaction, 98% partner satisfaction. I love that. I love that the partner satisfaction is actually higher than the patient satisfaction. The model that we use is I think the right one. It's got special coating on it to reduce the risk of infection. It's got a very natural feel to the material that we implant, so that it actually feels very normal and natural in the flaccid state, as well as in the erect state, in the soft state, and also in the hard state. And it is really remarkable that you can't tell the difference from the real thing. But most importantly, right, what does this change about what you feel and how you experience things? And the answer is, it really doesn't. So you may know, if you're a man listening to this and you've dealt with ED to any degree, you can have sexual sensation, desire for that, and pleasure all the way through orgasm or ejaculation with a crummy erection, right? And so the reality is there's two separate things going on down there at the same time. There's a hydraulics process, which I think we've talked through tonight, about pumping blood and trapping the blood there and holding it there to create pressure. And then there's the rest of it. There's the mind, the mental aspect, the sensation, and all that process all the way through orgasm, ejaculation. And so we can go in with the surgery, we can fix the one problem, the hydraulics problem. We leave the rest of it alone. I know, again, seems very odd that it would work that way, but it's true. So we can go in and we go in and we fix the hydraulics issue. We allow that rigidity to be restored, and the rest of it continues to feel and work like it always has. And I think that also is important to mention the partner side of it. Remember, the partner satisfaction being even higher than the patient satisfaction. And so everything works well enough that it's indistinguishable then for them as well. And I think another important part is that it's spontaneous. Once it's in there, it goes where you go. It's ready when you're ready. There's nothing else you have to carry around, nothing else you have to stop and do. That's another big thing that I've learned from men over the years, and it's going to work the same every time. I think that's another big thing is, even the pills and the shots, the one downside that we hear to those is, gosh, they're inconsistent. Sometimes it's great, sometimes it's not. It's very hit or miss. And I think, psychologically, I can only imagine as a man going into a moment like that, you don't want to let anybody down. You want things to work the same the way every time. And so That's another, I think, major benefit that we shouldn't overlook of the device. So there's always risks, and we talked about that infection is a risk. It's below 1% with the techniques that we use, as well as the coating of an antibiotic on the device. And again, there's always going to be a little bit of a healing process. It is a mechanical system, so it does have the potential to fail. And the average life expectancy, as I mentioned, is 10 to 15 years. But again, some aspect of the mechanics can eventually wear out or fail. And it's not something that you can then take out and go back to the way things were before. Not that there ever is a reason to take it out. And usually when you're thinking about doing this, because the other things aren't working anyway. But just to complete the picture here, we slide the cylinders into those chambers. We kind of disrupt that tissue in there, and it isn't something that you'd be able to easily slide out and go back to the way things were. But again, this whole thing is a very simple procedure, and we have a great track record in our outpatient center of a good experience for men and things like that. So the summary here is that this is part of life that really matters to every man, and that we want you to know there are options out there. There are simple options that we hope work, like pills, but we want you to know that in the instances where that isn't the case, that number one, we're going to investigate why you have the problem to begin with, and make sure there's no underlying heart disease, diabetes, et cetera, that we want to know about. But then we're going to get you onto treatment, and if the pills don't work, we're going to give you the other options. We're going to find something that works for you. And I think especially kind of some time spent here talking about the surgery, I think the important thing there is we can get you back in the game. We can get you back in action. If you're willing to, trust us and undergo a minor surgical procedure, we can essentially then guarantee that we'll be able to get you an erection back, so that there's never a point at any time in life where you have to throw in the towel and just say, I'm done with this aspect of life. If you're willing to, depending on what lengths you want to go to, we can certainly help one way or the other. On the topic of the implant surgery, of the oldest gentleman that I've done this on, actually two guys who are 86. And so, there is no age limit on this. And, I'm quite simply, if it's something that you want and it's safe and reasonable to do, and a part of life that you don't want to have to give up, then we can do it. Right. And so it's really every individual, every couple, every relationship is different. But if this is part of life that matters to you, we do really want to be able to give that back to you, and we can do that. So here are a bunch of the studies that I referenced along the way, if you want to go read all of those, which I don't necessarily recommend. And
If you could just keep on going down to
there we are. Okay.
there should be a slide with it.
Yeah. So